Few things are more frustrating than feeling unwell while being told everything looks normal. Blood tests come back in range. Scans don't show anything alarming, and yet you're exhausted, foggy, in pain, anxious, or just not yourself. This experience is common, and it doesn't mean your symptoms are imaginary, exaggerated, or all in your head. Modern medicine is powerful, but it has limits. Understanding why lab results can appear normal while you still feel sick can help you advocate for yourself and pursue answers more effectively. Normal is a range, not an ideal. Lab reference ranges are built from averages across large populations. That means a value can be technically normal, but abnormal for you. Subtle changes may not cross the cutoff for disease. Early dysfunction often exists before labs turn abnormal. For example, thyroid labs may fall within range even when someone has classic symptoms of hypothyroidism. If your body is used to functioning at the high end of normal and suddenly drops to the low end, you may feel significantly worse, yet still be told everything is fine. Labs measure. Snapshots, not systems. Blood tests are snapshots taken at one moment in time. They don't capture daily hormone fluctuations, stress responses, sleep deprivation, nutrient absorption, inflammatory spikes, nervous system dysregulation. Many conditions are dynamic, not static. You may feel worse in the morning, at night, or after stress, none of which may align with the moment your blood was drawn. Early disease often hides in plain sight. Most illnesses develop gradually. Long before a diagnosis appears on paper, the body often sends warning signals. Fatigue, brain fog, digestive issues, mood changes, exercise intolerance, pain without obvious injury, autoimmune conditions, metabolic dysfunction, hormonal imbalances, and neurological disorders often begin years before labs become definitively abnormal. Medicine tends to diagnose disease once it crosses the threshold, not when dysfunction begins. The nervous system isn't well reflected in labs. A significant driver of symptoms is nervous system regulation, which standard laboratory tests rarely assess. Chronic stress, trauma, burnout, and inflammation can shift the body into a constant threat state. This can cause palpitations, shortness of breath, dizziness, eye symptoms, muscle tension, fatigue, sleep disturbances. You can have perfectly normal labs and still have a nervous system that is exhausted, overstimulated, or stuck in survival mode. Inflammation can be local, not systemic. Most labs check for systemic inflammation, not localized or low-grade inflammation. You can have neuroinflammation, gut inflammation, joint inflammation, hormonal inflammation without elevated CRP or ESR. The absence of markers does not necessarily equate to the absence of inflammation. Hormones are complex and context dependent. Hormones don't work in isolation. Estrogen, progesterone, cortisol, insulin, thyroid hormones, and testosterone interact constantly. You may have normal hormone levels, but poor receptor sensitivity. Normal labs, but poor hormone timing. Normal values, but imbalances between hormones. For example, cortisol may be normal, but if it's elevated at night and low in the morning, you'll feel awful, and standard testing may miss it. Nutrient deficiencies can exist. Despite normal blood levels do not always reflect tissue levels. You can have functional deficiencies in magnesium ion, B12, folate, vitamin D. Symptoms can appear long before lab values fall outside reference ranges. Medications can cause symptoms without abnormal labs. Many medications alter mitochondrial function, appetite regulation, sleep cycles, neurotransmitters, gut motility, weight gain, fatigue, anxiety, and brain fog can occur even when labs remain normal. Side effects don't always show up on blood work. Mental health and physical health are not separate, and depression, anxiety, and chronic stress are physiological states, not character flaws. They alter immune function, digestion, pain perception, and energy production. Normal labs do not rule out suffering. The problem is often the question being asked. Labs only answer the questions we think to ask. If the wrong tests are ordered, or the right tests at the wrong time, the answers will be incomplete. Medicine is excellent at detecting disease. It is less skilled at recognizing early dysfunction, chronic stress injury, and system-level imbalance. What you can do, if you feel sick but labs are normal: track symptoms over time, not just severity. Advocate for yourself without apologizing. Ask what was not tested. Focus on sleep, nutrition, and stress regulation. Seek second opinions when needed. Work with clinicians who treat people, not just numbers. You deserve to feel well, not just within range. Normal labs do not mean nothing is wrong. They mean that what's wrong may be early, subtle, complex, or outside the narrow lens of standard testing. Your symptoms are real, your experience matters, and your body is not lying to you. If this resonated with you, like, share, and subscribe for more health explanations that actually make sense. If you've ever been told your labs were normal while you felt anything but, leave a comment below. Your voice may help someone else feel seen.